Assalamualaikum warahmatullahi wabarakatuh. My name is Faisal. I'm resident of Oral and Maxillofacial Surgery, Faculty of Dentistry, Hasanuddin University. The title of my paper is Challenge and Management of Acute Severe Odontogenic Infection in Patients with Systemic Comorbidity during COVID-19 pandemic. This is a report of 3 cases and review of the literature. Introduction. Odontogenic infections caused by pathological changes arising from the teeth and have specific microorganisms. Pulpitis, periodontal disease, radicular case, and other oral disease are the initiation infection that can lead to the formation of facial cellulitis and abscess. The incidence and mortality of odontogenic infection has decreased since the invention of antibiotics, but it still have challenging factors like potentially fatal complications, including airway obstruction, mediastinitis, epidural abscess, and internal jugular vein thrombosis. Uh, The other challenging factor is systemic comorbidity and complex anatomy of odontogenic infection. One of systemic comorbidity in odontogenic fashion is diabetes mellitus. Diabetes mellitus is a metabolic syndrome characterized by inappropriate elevation of plasma glucose level due to absolute or relative insulin deficiency. In these patients, there is a decreased function of neutrophil that increase bacterial infection vulnerability. The patients with diabetes mellitus usually having higher risk to infections and having poor response to infection. The other systemic comorbidity of our patients is hypertension. Elevated blood pressure is associated with congestive heart failure, stroke, and ischemic heart disease. The patient with hypertension require a practical approach to identify mitigating factors that increase blood pressure. The GNC7 reported defined hypertensive emergency when systolic blood pressure is above 1/79 or diastolic blood pressure above 1/19 associated with symptoms of acute condition or in organ failure sign. The SARS-CoV-2 pandemic caused unpredictable disruption to oral and maxillofacial surgeons in secondary healthcare service. The COVID-19 transmissions occurs via aerosols, therefore assessment of aerosol generating procedures including abscess drainage was of particular interest that need modification of treatment. Assalamualaikum warahmatullahi wabarakatuh. My case report of 3 patients. The first case, a 77 years old woman was referred with a complaint of painful swelling in the left submandibular region and there is a difficulty in opening the mouth. The opening of the mouth is about 16 mm. She had history of pulpitis and extracted tooth on the lower jaw. The patient's medical history revealed grade 2 hypertension. From the extraoral examinations, we found a soft, tender, swelling and fluctuant mass on the left submandibular and submental region with 150 mm, 150 mm, and 70 mm in size. The surface skin was slightly red. This is the picture of our patient when referred to our department. There's a left submandibular abscess extended to submental. On the initial assessment of our patients, the vital signs: heart rate is about 90 times per minute and the temperature is 36.67 degrees Celsius, and respiration rates is about 23 times per minute, and the blood pressure is about 140 for systolic and 100 for diastolic. The results of laboratory examinations reveal leukocytosis and elevated blood glucose level, and hemoglobin A1C level was 7.2%. It was a strong indicator of our patient to diagnose with diabetes mellitus. This is the picture of surgical exploration that revealed tissue necrosis. We performed debridement and necrotic debris removal. Case 2. A 64-year-old male was transferred to our hospital as an emergency admission. He presented with massive swelling and painful in the left submandibular region 11 days before admissions. Within a week, the infection progressively spread to the floor of the mouth, buccal, and temporal space. The vital signs of the patients. There is a tachycardia in our patient's heart rate shows 121 times per minute. The temperature is about 37 degrees Celsius. The respiration rate shows 24 times per minute, and the blood pressure is about 120 per 80 for systolic and diastolic. On the initial assessment, the patient was found to be conscious with asthenia and dysphagia. We found hypernatremia and hyperkalemic condition. From the extraoral examination shows there is a facial asymmetry with swelling and fluctuant mass on the left buccal area extended to submandibular and submental region. The surface skin was red, warmer than surrounding tissue, with the fluctuant on the submandibular area. The white blood cell examinations reveal leukocytosis in our patients. This is the picture of our second patient. There's a severe odontogenic infection on the submandibular region. Case 3. A 61-year-old man was examined in the emergency unit in our hospital due to chief complaint of worsened submandibular swelling and painful on the left side that extended to submental region 8 days before admission. He had history of hypertension and diabetes mellitus type 2. On the initial assessment, he presented asymmetrical face with swelling and fluctuant mass of the left mandibular extended to submental region. Vital signs of the patient. From the initial examination, we found tachycardia and tachypnea, and there is a consistent elevated blood pressure in our patient. The result of the laboratory examinations reveal the hyponatremic conditions and leukocytosis, and there's a high blood glucose level. The treatment part. The severe infection condition needs careful assessment and should be managed more aggressively. The basic principle in managing odontogenic infection, including determine the severity of the infection and assess host defense, electing the setting of care, the surgical intervention like incision and drainage, and the last, the medical support and antibiotic therapy. In this in this pandemic, we should perform nasopharyngeal swab for SARS-CoV-2 screening before taking a surgical intervention in our patient. The surgical intervention should be consist of incision and drainage, following by blunt dissections to explore the cavity of the abscess, irrigations for dilute of the bacterial load, following the placement of the drain to ensure the adequate drainage of the abscess. And sometimes we perform necrotomy debridement to remove the necrotic tissue and debris from the site of surgery. Review of the literature. This table shows the management of infection in maxillofacial region as emergency setting during SARS-CoV-2 pandemic for 3 patients. COVID-19 illness may be asymptomatic in significant proportion of cases, but it is affected the treatment of infection in these patients. Incision and drainage is an aerosol generating procedure and still become the mainstay of the treatment of several abscesses in the maxillofacial region, and the surgical intervention should be performed after SARS-CoV-2 with nasopharyngeal swab, and we must wearing personal protective equipment for the surgeon. The combination with the antibiotic therapy shows the significant improvement for all cases. Assalamualaikum warahmatullahi wabarakatuh. The last, I would like to say thank you for this opportunity.